Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Arun Kumar M. He is a pediatric and adolescent endocrinologist. He is MD from Rishikesh All India Institutes, and also he worked in Delhi All India Institutes and Lady Hardinge Medical College as assistant professor of pediatrics. But now he is working in Chelvamba Hospital in Mysuru and doing a human service to the endocrinal problems in the newborn as well as the adolescent people. Welcome, Dr. Arun Kumar.
Thank you. Thank you.
You know, we all know about the thyroid. Everybody, every Tom, Dick, and Harry, they say, "Oh, I have thyroid. Oh, I have thyroid." The adult thyroid hypothyroidism is well known, but in children, newborn babies, the congenital hypothyroidism, how is it difficult and how to detect? What is the difference between the two?
Yes, madam. As you said, we all know about the adult hypothyroidism. Every adult person, old age person, they will say that I had some weight issues, constipation issues. I got my thyroid tested, or on a routine screening, I got tested that I detected with the low thyroid hormone level. So I am on the treatment. But the similar entity can happen in the newborn children that most of us don't know. If we tell anyone that this child is having the newborn, the 3 days child, 5 days child having thyroid issues, people think like, oh, what an era has come that even the
I
small
know.
children have started
Correct.
getting these thyroid issues. No, that's not true. Actually, it's that lack of knowledge we have regarding this subject.
Awareness
Congenital,
is less.
yes,
Awareness
yes.
is less, and that's the problem. Okay. In the olden days, it was called as cretinism, and people were very much worried about cretinism. But now the name has changed. But people should remember that it is very important because timely detection can make the baby totally normal. Yeah, please
Yes.
go ahead.
Yes, so hypothyroidism is one such entity where the body is having low levels of thyroxine hormone. Thyroxine hormone is one such hormone produced from the gland called as thyroid gland, which is present in front of our neck. It is a
Yes.
butterfly-shaped
Whisper.
gland.
Yes.
Yes, it's
Yeah.
a small gland. Its work is to produce thyroxine hormone. Thyroxine is responsible for brain growth and overall growth in children, and also maintaining the bodily functions like basal metabolic rate in adults.
Yes.
So because of some issues, when the gland stops working, the thyroxine levels will go down in the body. What happens in adults is we call something called as immunity in our body. The work of immunity is like a police in a city. The work of
Yeah.
police is to
To
protect the
protect.
normal people and to get rid of all the bad people. Sometimes what happens is this police will go corrupt and they get confused because of some issues. This police will start troubling the normal people whom they were supposed to protect.
Protect.
Similarly, in the body, the immunity thinks like this thyroid gland is not mine. It is causing some problem. It gets confused. It will start attacking on the thyroid gland itself, on its own body. So because of this, what happens is this thyroid gland slowly gets decayed. So once the thyroid gland is completely non-functional, the thyroxine hormone
We
levels
call
goes
it as
down.
a autoimmune disease.
Autoimmune disease.
Autoimmune
So this
disease.
is what
Yes.
happens in adults and adolescents. Somewhere around
Yes.
12 to 15 years after that, this kind of disease is common. But what
Common.
happens in newborn children, the just born baby is, in them, the gland itself is not formed well.
Yes.
Similarly, we have fingers, hands. Sometimes some people have short fingers. Sometimes some people will have short limbs. Similar to that, the thyroid had some problem because of
It
which the
will be
thyroid gland
small
could
in
not be formed,
size or it may not be
be
functioning.
present
Yes.
at all. So that is called as thyroid agenesis or degenesis. Because of that, there is no hormone. Sometimes the gland will be present because of some technical errors. We call it as enzyme deficiencies inside that process. So because of that also, there might be non-functioning of the thyroid gland. Because of that, the thyroxine levels will go down. So this condition is called as hypothyroidism, and in the children, it is called as the newborn babies. It is called as
Congenital.
congenital hypothyroidism,
Right.
and it's a very common disease to that extent that every 1,000 normal deliveries, like every thousand
One
children
baby will
born,
have.
one baby will have that congenital
Yeah.
hypothyroidism.
Yeah.
That common it is.
And this is very important because unless it is detected and treated in time, the child will become like a adult, and then the intelligence will be very low, and then they cannot compete with the others. Now, how to detect? Because adult clinically we make the diagnosis, but in children, how to make the diagnosis?
In the newborn babies, till the baby is born, it will get some amount, even though its body is not producing, the baby will get some amount of thyroxine through the umbilical cord from the mother. Because mother is having sufficient hormone, she will send. So when the baby is inside mother's womb, the baby will develop normally. But once the baby is born, even for day-to-day basic activities of the baby, including maintaining the temperature, for the brain growth, for the overall activity, the thyroxine hormone is important. From the day one, the baby's thyroid gland has to produce its own hormone, but it is not functional. So, because of this, the symptoms will come over a period of time. It is not
Okay.
like some acute hormone. So, because of this, we will not have any symptoms in the baby at the time of birth, even till few months
Uh,
also.
but this is what to say, camouflage. We will not come to know until it is too late, and by then it is
Yes,
too late to revert
yes,
the damage
got
done.
it. Yes,
So,
yes.
how do you, what test do you do to detect this
Yes,
in
ma'am.
that
So
case?
here the clinical examination component will go bit down. So here basically it depends on our laboratory assays. What we do is newborn screening for thyroid disease. We do a
Hmm.
TSH assay. Some
Hmm.
places we do thyroxine hormone also directly, but basically we do the thyroid TSH assay. In that we will get to know whether the thyroid gland is
That
able
is
to function
thyroid
normally.
stimulating hormone assay.
Hormone, yes,
Yeah.
yes, yes. So there are multiple types of assays. There are stimulating hormone assays, or sometimes we do directly free T4 hormone levels also. But
Hmm.
commonly used is the TSH assay because of the multiple factors. So
Hmm.
anything we can do, just do a screening when the baby is born. Usually
But
the screening is done in the umbilical cord blood itself or after
okay.
the 3 days. So it has to be done before the baby gets discharged from the hospital.
Discharge from the hospital. Yes. Yes. And this
So
is being done in many states,
yes,
voluntarily every child is in. But it is not in pan India. All over it is not there. So
yes,
even if it is not there in the government hospitals, the people, if they have the awareness, they can ask their obstetrician to get it done. And I
yes,
think every parent should ask and every obstetrician should get it done. And
yes,
every neonatologist should see that it is done in time.
yes.
Otherwise, a stitch in time saves nine, they say. But here, treatment in time, it can save the patient's whole future.
Yes.
How do you treat them?
We treat them with the thyroxine hormone only. Like similar to
Hmm.
adults, whatever the etiology it is, the final the problem is the deficiency of the hormone in the body. So
Hmm.
similarly in the child also, we this there is a deficiency of the hormone, so we give the thyroxine tablets. There is
Hmm.
no powder or syrup form because it will be very unstable. So we make it
Okay.
a tablet. The tablet will
Okay.
be crushed and mixed in the breast milk and will be given to the baby daily
Oh,
morning.
wow, that's nice. Yeah. So
So
once a
yes, once a
day,
day.
and the dose, how much dose do you give?
For
Depending on
children,
the
the
body
dose will
weight.
be,
Yeah.
yeah,
Hmm.
yeah, depending on the body weight. But for the children, the hormone requirement will be high. For adults, we
Very
give
high.
somewhere around 1.5 to 2 microgram per kg. But for
Okay.
newborns, it is somewhere around 10 to 15 microgram per kg.
Wow.
As age
Oh.
advances, the dose requirement will come down. We routinely check for every 1 to 2 monthly once in the newborn initial
Hmm.
period till the
Hmm.
infancy, and we adjust the drug dosages according to the hormone levels in the blood.
Okay, okay. So ultimately, what words of wisdom would you like to tell the parents?
I would like to tell that it is just a single test which can change the entire life of a baby. Just
Yes.
imagine, like, I check for 1,000 babies.
Hmm.
In 999, it might come normal.
Hmm.
But that 1,000th baby who is having congenital hypothyroidism, if he was detected in time, his
Hmm.
life is completely changed. It
Yes.
is one of the important reversible cause of mental retardation or
Hmm.
intellectual disability, we call it as. Like
Hmm.
just a single test and a simple tablet in the morning. I just give
Hmm.
an example to parents. Parents think like, oh, such a big disease has happened to my baby. It is just a
Hmm.
small baby. Why I have to give
No.
medication to the baby? No. When we are having food, if there is no salt in the food, what do we do? Do we throw
You
the
add
food?
it.
No.
You add it to
You
that.
just add it.
Yes.
Just
Just add
similar to
it.
that. This
Yes.
baby's body does not have thyroxine. Just add
Hmm.
the thyroxine from outside. The baby will be absolutely normal and he will do completely normal like any other child.
And mental retardation can be prevented totally.
Prevented. Yes.
And,
Yes.
for that child, it is 100%. So
Yes.
that's the reason, everybody should take care and then see that every child has got a right to be intelligent and normal in their life. And let us all join hands in making that best effort for the child. Thank you very much, Dr. Arun Kumar, for giving such wonderful advice to the parents. Namaskar.
Thank you, madam. Namaskar.